Good morning, Mrs. Jones. My name's Morgan. I'm going to be your student nurse today.
Hello.
How are you doing?
I'm good.
Can you please go ahead and state your full name and birth date for me?
Sharon Jones, 02/01/1985.
Perfect, thank you. All right, the doctor has ordered a dressing change and a blood draw and a cap change for you today, okay? How long have you had your central line?
Like a year and a half.
Okay. So with the dressing change, we do those, we change those every 7 days, unless it gets dirty or soiled, unless it gets soiled or wet or it starts peeling away, okay? So if we do a dressing change today, when would you expect another dressing change to be done?
Oh, probably in like a week, or unless it starts to get gross or come off.
Perfect. All right, we're going to be setting up a sterile field once I take off the old dressing, okay? And that's why you have that mask on, so that if you need to cough or anything, you just turn your head to the left and make sure you cough in that mask, okay?
Okay.
And do you know what a sterile field means?
That means when you're extra careful to not get any germs anywhere, right?
Yeah. And you'll be laying down supine in the bed, so I'll need you to lay very still. So don't move your hands or your feet or anything, okay? And I'll let you know when that'll start, okay? Have you had any problems before with a dressing change?
Not really. Sometimes it sticks to my skin a little bit, but other than that, it's usually okay.
Okay, well I have some alcohol swabs to kind of help with that, okay?
Okay.
Okay, to help with so it doesn't pull on your skin, you just wipe around the edges with the alcohol wipe. And it'll make it easier to pull off, okay? I'm going to work it towards the center. Getting all my edges so then it doesn't pull on the line at all, okay? And as I'm doing this, I'm checking for any signs of infection, any tenderness or pain.
No, I'm okay.
Okay, good.
That was pretty easy.
Good. I don't see any redness. I don't see any drainage on the old dressing, so I can clean that up. All right, so in between cares, we want to make sure we use hand hygiene, okay? So if you see me or another staff member not doing that, you remind us, okay?
All right, I'll do that.
Okay, we're going to set up our sterile field now, okay? So you just lay still there. right. Okay, don't need that anymore. Let me pull out a few things that I don't need. Okay, now this is chlorhexidine. This is going to be used to clean and sanitize around the area, okay? And my left hand is going to hold the tubing so I can move it if necessary, okay? All right. Okay, now the dressing change, okay? We're putting on the clean dressing. Doing all right?
Yep, so far so good.
Okay. All right, and I have a label here. We always want to label it so we know when we changed it, okay?
Okay.
So I'll put your name, or excuse me, I'll put the date, the time, and my initials, okay? There we go. Okay, now I'm gonna go ahead and get cleaned up. We'll work on the blood draw, okay?
Okay, that didn't hurt at all.
Good. Now, can you tell me something that I need to do before I do anything else?
You need to do hand hygiene.
Perfect, good job. This just keeps you safe, okay?
Okay.
And we'll do that cap change too once you get done with the blood draw, okay?
How often are you supposed to change the cap?
So the cap is also the same as, it's 7 days also, or every time we do a blood draw. And there might be something else in there. I'll have to double check and get back to you on that, okay?
Okay, that sounds good.
Go ahead and get some gloves. So anytime we do anything with the cap, we always clean it, okay?
Okay.
With an alcohol wipe. Anytime we do a flush or a change or a blood draw, anything, okay? And we do that, we wipe it for 15 seconds, okay?
Okay.
So if somebody was coming in to draw blood, how long would they need to wipe it for?
15 seconds.
Perfect, good job.
And then they have to change it.
Yeah, very good. And make sure they get the top, not just the sides, okay?
Okay.
All right. Okay, so I'm going to do a flush first. Make sure the line's patent. And it looks like somebody forgot to clamp it, so I'm going to go ahead and make sure that's clamped, okay? We keep that clamped all the time. Except for when we're pushing or pulling things through, okay? I'm going to unclamp it. I'm going to use positive pressure, so that's stop and go.
Okay.
Clamp. Now we'll pull up the blood. And I'm going to pull up 5 cc's first, and this one will just be wasted, which means we're just going to put in the biohazard. And we do this to make sure that there's no residual fluid in the line or anything that could cause the blood draw to be too dilute. Okay? So that'll go in the biohazard. Okay, now this time I only need 3. It's a small test tube. We'll go a little more just in case. All right, now I can let that go. So on this test tube, I'm also going to put your name and your birth date, okay, and the time I drew it and my initials. And I'm also going to put the date today, okay?
Okay.
And I would close that in syringe and put it in the biohazard. Okay? So we'd write out all that information I just told you I'd get. And we'll take that down to lab, and I'd have my CNA take it down, or I can take it down as soon as I'm finished here, okay? All right. So I'm gonna go ahead and change my gloves and use hand sanitizer again, or wash them if I felt like I need to.
Okay.
We're gonna go ahead and change that cap, okay?
Because you just drew blood, right?
Yeah. And you know what? I only have one there, so I'm just gonna grab my pocket and grab the extra wipes I have. Thought I had some extras. I'll have my assistant go get me an extra wipe just in case, okay? Thank you. All right. So I'm going to go ahead and clean the cap again now too, okay? And how long would I clean it for?
15 seconds.
Okay. Okay. I'm going to go ahead and pull it off. And I'm going to check, make sure it's not dirty around it or anything. Pull out my new one. Okay, I'm gonna unclamp and I'm gonna flush this one, okay? Okay. Now I have 5 cc's of heparin I'm going to put into the line also. Do you know what that's for?
I don't.
Okay. That's fine, not a problem. I can explain it to you. Okay, because I haven't let this touch anything, I can go ahead and attached to the syringe. Heparin is an anticoagulant agent, so it's going to make sure that there's no clots forming in this line, okay?
Okay. You don't want it to get plugged up, right?
Yeah, we want to keep it clear. All right. And I'm going to change out this tape here, and we'll put a new piece on there, okay? There we go. All right, Mrs. Jones, there you go, and I'll be back in to check on you here in a little bit and see how you're feeling, okay?
Okay, that sounds good.
All right, I'm gonna get things cleaned up. Thank you, Mrs. Jones.
Thank you.